this is Sidra, and today we'll be talking about anatomy, what the definition of it is, what are the different types, and why we need to study it. I know a lot of people who hate studying anatomy, and there's even expert clinicians who've been practicing for years who tend to struggle with it. So hopefully we'll cover how to effectively study the subject and make it stick in your head. Anatomy comes from the Greek root anatom, which means to dissect or to cut. Dissection, however, is just a tool, and the actual definition of anatomy is the study of organs and structures inside the body and appreciating how they're all organized together. There's various different types, and we'll touch upon a few of them briefly. There's what we can see with the naked eye, also known as gross anatomy. We can study it regionally, which is part by part studying and appreciating what's inside one area, and systemically, which is studying all the structures that are connected to perform a singular function. There's also microscopic anatomy, and that's also known as histology. As you might all know, histology is the study of the organization of cells and tissues in various parts. There's other relevant types, such as surface anatomy, which is important in physical exams and procedures such as chest drains and performing lumbar punctures. There's radiology, which is interpretation of X-ray, CTs, and MRI, and knowing what might be wrong. There's also embryology, which is the study of the developing fetus and how, if something goes wrong, what clinical problems can arise from it. And then there's living anatomy, which is watching anatomy in real time via endoscopy or bronchoscopy. There's genetics, which is chromosomal effect on the body. There's also comparative, which is between different animals. There's physical anthropology, which is important medical legally, and it differentiates the differences between different races, between male and female, and it can also be used in archaeology. And lastly, there is experimental anatomy, which is how different factors affect the body. The most important is, of course, clinical or applied anatomy, and that is a functional approach, and we use anatomical knowledge to diagnose and treat different clinical problems. Now we come to why we need to study anatomy, and that's because it forms the basis of medical practice. It is the only thing that gives us a clue to what is or what might be happening on the inside. It informs our physical examination, how we interpret imaging, and of course how we perform surgery. And of course we need to study it to pass exams as well. You can liken anatomy to a building whose structure allows specific functions to take place inside, and that will make physical examination its architecture, imaging its blueprint, and surgery the internal plumbing. Now we come to the juicy topic of how actually to study anatomy in a way that it stays in your brain. It's very challenging and there's a lot to cover, but it's very helpful to know your syllabus and to break it down into small to medium-sized chunks and put them all in a table. And I'll show you how to use this table in a minute. And then you should have access to question banks and past papers, and notice what's coming up a lot and use that to reinforce your topic list and focus on those subjects the most. In surgery, we have the adage, see one, do one, and teach one, which is really helpful in learning clinical skills and practical procedures. You should also be using as many of your senses as you can. So visualize things, listen to audio lectures, and then of course use your touch to practice surface anatomy on yourself, or to look at models and to label them. Anatomy isn't studied over hours, it's studied over 10 minutes a day. You can revise a small topic of anatomy in your daily commute or whenever you get the time, and that's utilizing the principle of active recall. You shouldn't have a textbook in front of you. You should be testing yourself and kind of getting an idea of what your knowledge level is. So you can use flashcards, a list of questions, diagrams, or mind maps to do this, whatever you're comfortable with. And then check your answers with a textbook and then add to your knowledge. And each time you repeat it, the more answers you'll be getting correctly. And then every time you do revise it, you can go back to the table that we made and then put down the date of when you revised it. So that way we can do spaced repetition. So you can revise things over the day, in the same week, and then over the month, and that way you will be defeating the forgetting curve, which is the idea of which is to revise something before your mind has a chance to completely forget it. And that way anatomy will stick in your head, and by the time final exams roll around, you'll actually know what you're talking about. I have a lot of goals for this channel. One of them is for me, which is to learn by teaching you guys, and the others are for you guys, which is to make sure that people do really well on exams like the MRCS, and for there to be an accurate and accessible source of information. It is human to forget, and there's no shame in revising before you go into a surgery. Many surgeons do that, even the most experienced ones. I want to equip people with the knowledge to become capable and confident surgeons who not only are able to perform surgery well, but also prevent unnecessary operations from happening on people, and to provide reassurance to patients like that. If you like this video, please give it a thumbs up and share it far and wide. Subscribe to the channel and hit the bell icon to be notified about the videos that are coming out every week starting from this week. Thank you and have a wonderful day.